Hello guys, in this topic we are going to discuss about FAB classification of AML. It is a very important topic and you have to remember it, right? And a lot of questions are asked. It is an extremely important topic, can be asked from pathology, medicine or pediatrics also, right? So what are FAB classification? There are 7 types of classification starting from 0 to 7. So that's why 8 types of classification actually in FAB classification. You have to remember the names first. So first of all, M0 is minimal differentiation. M0 is called minimal differentiation, right? Then M1 is myeloblast without maturation. Myeloblast without maturation. Then coming to M2, what will be M2? Myeloblast with maturation. With maturation. Then M3. M3, it is very easy and very important. Acute promyelocytic leukemia. Acute promyelocytic leukemia. What about M4? M4 is myelomonocytic leukemia. M5 is monocytic or monoblastic, right? Monocytic or monoblastic. Monocytic, then it is 5A, and if it is monoblastic, then it is 5B. Sorry, I wrote the wrong thing. If it is monocytic, then it is 5B, and if it is monoblastic, then it is 5A. Right, then M6. M6 is erythroid. And lastly, M7. It is megakaryocytic. Right. Now we will discuss within these topics. Right. So in M0, we only need to remember the name. In M1, only name. M2, apart from the name, you need to remember that it is the most common variety. Right, it is the most common variety. Second important point, translocation 821 is present. Then chloromas are seen and it has a good prognosis. Right, see, in whole of this FAB classification, only you have to do is that is rote learning, right? You cannot understand things, it is rote learning that is required, right? The most important point over here is translocation. Mostly translocations are asked, so always look at these translocation and remember these translocation. It is the most important thing. Now coming to M3. M3 is called acute promyelocytic leukemia. It occurs in young patients. Next, it has good prognosis, right? It has good prognosis. Next, translocation 1517 is present, right? So extremely important. This is the most important stuff in the whole of this video, right? So you have to remember it. Next, our rods are present, and these R rods can lead to DIC, right? Second most important thing. So these can lead to DIC. A photo of R rods can also be given for making you understand these things, or question can be asked that which type of FAB classification does it belong to. Now coming to M4. M4 is myelomonocytic leukemia, right? Myelomonocytic, right? Now inversion 16 is present, very important. These numbers are actually very important. Then translocation 16 is important. How do I remember these? 4 ka square is 16. So this is the way I used to remember these things, right? 4 ka square is 16. So inversion 16 or translocation 16. Then eosinophilia is present in it, and gingival hyperplasia. Gingival hyperplasia is present. Another very extremely important thing, gingival hyperplasia is present in N4. Now don't think that N4 is the only place where gingival hyperplasia is present. Gingival hyperplasia is also present in N5, right? Very important, gingival hyperplasia is also present in M5. Extremely important. Next, what are the other features of M5? Organ infiltration. If the question stem says you that organ infiltration is present, then always think of M5, means monocytic or monoblastic. Then high WBC and fever is present. And there's another one thing that is called sweet syndrome, that is also associated with M5, right? If you want to know about sweet syndrome, then just Google it, right? Then coming to M6, it is erythroid, right? First most important thing, that M6 is mainly therapy related. M6 is mainly therapy related. It occurs due to therapy. Another name of this M6 variety is arrhythmic myelosis. Another name of M6 variety is arrhythmic myelosis. Extremely important, arrhythmic myelosis. Next, a disease which has a very funny name, D. Guglielmo's disease, is associated with it. Not very important. And very important thing, that it has poor prognosis, right? Very bad thing, it has poor prognosis. What about the other ones? M2 and M3 variety, you have to remember these have good prognosis, right? So always remember the translocation and the prognosis that is related. These things are very important. You have to remember the prognosis and the translocations present. Now coming to the last one, which is megakaryocytic, right? The last one is megakaryocytic. In megakaryocytic, the translocation present is CD41. Sorry, it is associated with CD41 and 46. Another very important thing, numbers, right? It has a very bad prognosis, very important, extremely important. And then it is associated with Down syndrome, right? Another extremely important thing I am telling you, Down syndrome. And if it is associated with Down syndrome, if M7 is present alone, then it has a bad prognosis. But if it is associated with Down syndrome, then it is actually a very good prognosis, right? It is actually a very good prognosis, right? Next and the last thing, M7 is associated with bone marrow fibrosis. Now why bone marrow fibrosis is present? Because megakaryocytic, it is megakaryocytic type, the name is megakaryocytic. Now what do platelets or megakaryocyte release? They release platelet derived growth factor, and that's why platelet derived growth factor has a function of doing fibrosis. That's why bone marrow fibrosis is a feature of this particular M7 variety. So I've completed all of it. It is extremely important, and mark my words, it is a topic that you cannot leave before your examination, and everything I've written is important, especially the boxed ones, means the special things about it and the translocation numbers and the prognosis, right? So this is the photo of my first aid book that I annotated this particular topic in my first aid book in hematology section. Everything I taught you in this video is written from here. I'm taken from here only. So you can take a screenshot of this particular page also. This is enough, right? Thank you.